Hello dear friends, this is a complex case but also very interesting case of a complex Crohn's disease. This patient is a 47-year-old lady with complex history of Crohn's disease, previous surgery with partial resection of the small bowel and part of the large bowel, and we can see first of all the postoperative changes. On the right side we can see a stoma here, and the reason is that at this point between the right colon and the distal ileum there is an anastomosis here, and let's go up. We can follow the small bowel which enters exactly to the stoma here, and there is a loop ileostomy at this point. Additionally, as you can see, there is a parastomal hernia which is uncomplicated. There is no obstruction. On the left side here there is another stoma which represents a mucus sigmoid fistula. It's another kind of stoma here. This is a previous CT scan where we can see some postoperative changes in the perineum in this region. And we can see some inflammatory changes as well. Here is the current CT scan with some persistent inflammatory changes around the perineum. At the left-sided stoma we can see some inflammatory changes as well. And another point is that there is persistent inflammatory changes in the transverse colon. There is edema and thickening of the wall of the large bowel, of the remaining large bowel here, up to the left colonic curvature. You see the thickening of the wall, and there is some prominent mesenteric vasculature around. It's a chronic inflammatory changes due to the known Crohn's disease. There is also mild fat stranding, pericolonic fat stranding in this region. At this point, the right colonic curvature looks almost normal here. So you can see the difference from the normal to the pathological. The inflammatory changes. Another complication is that there are some presacral inflammatory changes with a small amount of fluid in the presacral region. Inflammatory changes. There are also inflammatory changes in this region, and all these are locules of fluid representing chronic collections. It's quite difficult to be differentiated by the surrounding small bowel loops, but it is very important to be identified. These are collections. They don't have any continuation. If we track the bowels, there is no continuation with these structures. At this point, I would like to make some comments about that it is a matter of practice to learn how to track the gastrointestinal tract up and down. For example, let's say this part of the gastrointestinal tract, we must learn how to track it up and down and see its continuation. Okay. The aim of this presentation is to be familiarized with possible complications of Crohn's disease and what are the possible operations of the patient. Thank you for watching. See you the next time. Please subscribe to my channel if you find my videos interesting. Thank you.